Hello, welcome back. So today's topic is constipation. It's the most very common problem. Everybody, goes to the doctor, a gastro doctor, because of the constipation, or at least everyone once in a lifetime they would experience constipation, or they would have seen people suffering out of constipation. So, what is constipation? Generally, we know if you don't pass motion every day, that's called constipation. But the definition is entirely different. It's not that simple. But people every day they pass motion also may be constipated, and people they don't pass motion every day also may be normal. But generally, we say anything you strain, and if it's not passing every day, it's constipation. Let's see what are the reasons, common reasons for someone suffering from constipation. Constipation, generally, everybody knows, it's all because of diet. Diet is very important. That's the first reason we can say, because diet means diet should be the right time. The quantity and quality of the food is very important, and the timing of food is also very important, because we are all trained by our toilet training when you are very children. So morning when we get up around maybe 6 o'clock, 7 o'clock, we brush and go to the toilet, and we have a 3 meals a day pattern. This is how we are all trained. And suddenly we change our pattern. Maybe suppose you skip the meal, or maybe you have a late dinner, something, then you can get constipation because of even though you have food, but the timing makes it constipated. This is one part. And of course everybody knows fiber. Fiber is very important for a normal free flow of motion. Then if you have a fiber less diet and more of a carbohydrate, and this ultimately result in constipation. So the food is very important, not only the quantity and quality, the timing and other diseases, all inclusive. Then of course physical activity. Physical activity is very important nowadays. Everybody is have a very sedentary lifestyle. Most of the time we have a desk job and no exercise, or no not even walking. So this physical activity makes the intestines to lack of physical activity makes the intestines to move in a slower speed, and it can result in constipation. This is a general. So food and physical activity. Then comes to individual, like why children are constipated. Generally children are naturally constipated because their digestive system and other systems, internal organs, takes time to mature and develop. Usually it takes 12 to 13 years for the digestive system to mature and develop. So in that period of time, it's quite natural for the children to have a constipation. And of course the toilet training also plays a major role. The children may not learn the toilet training, so they don't know they may not get the habit, or they may not understand. So their toilet training takes time. In this period they can get into constipation. So the untiming of, suppose they go to the school and they want to pass motion. These are all because of the mainly for the toilet training part. And other reasons, of course, childhood obesity. Nowadays childhood obesity is very, very important. Obese children have less physical activity, and obese children have a lot of fat inside the intestines, so that can also lead to constipation. And coming to adults, in women are a little special. Why? Because their pelvic shape is entirely different. So the pelvic shape is mainly for the childbearing. So the pelvic shape differs from the male. So they can be constipated. The other reasons, women, when they have a problem in their monthly cycles, either because of PCOD, polycystic ovarian disease, or some other chocolate cyst ovary, or like their hypothyroidism, the intestines will move very slowly, so they can get into constipation. And during pregnancy they can end up in constipation as well. The reason being that when the child grows bigger and bigger, it puts pressure on the sides of the abdomen wall and the pelvic floor, and also on the rectum, so they can get constipation. And come to the old people, male reasons most of the time they are habituated to be constipated, or even because of some drugs, or even because of certain surgery, prolonged illness. These things are people who are on weight loss program. Suppose people on weight loss program, when they cut down their food intake, naturally the output also becomes less, though they can get constipated. So these are the adult reasons for constipation. And old people, of course, they also come under a special category. The reason being, when we get older and older, our intake of food also comes down. So naturally the output also comes down. So they can get constipated. And most of the old people, they may have some medical diseases like diabetes, hypertension, cardiac problems, something. So they may be taking a lot of medications. So these medications naturally can end up in constipation. And most of the elderly people think they should pass every day morning this much of motion. So when I was young, I used to pass motion this much. Now this is not possible. When you get older, you can expect a constipation is a normal phenomenon. And generally, if you are seeing people who are suffering from constipation, it's very really pathetic for them, because those people who have a real constipation, they suffer a lot. It can in fact affect their day-to-day life activities. If they don't pass motion, if they are constipated, they feel bloated, they have pain, that will avoid them go to the job or maybe traveling. All these can be affected. See, that is why we say, as per the definition, that doesn't mean you have to pass every day this much of motion, but if you pass a good amount of free motion, then it's good. But if you're not passing motion for 1 or 2 days and it's not troubling you, that is also no problem. But if not passing motion causes a trouble like pain, bloated sensation, sometimes breathing difficulty, they will be restless, these kind of things has to be addressed and needs to be seen by a gastrosurgeon or a gastroenterologist, and need to be evaluated, and they need treatment for that, for a very healthy lifestyle. Thank you.